It is my pleasure to welcome Natalie Alcorta. She is the Resources and Information Manager for us here at Age of Central Texas. And in that role, she helps older adults and family caregivers to navigate the realities and the opportunities of aging. And she does that with one-on-one consultations with the folks who are in need of resources, just like we're going to discuss today. Natalie graduated from the Texas State University with a degree in social work, and she is just a wealth of information. Unfortunately, it looks like Natalie's having a little bit of difficulty being able to jump on right at this moment. Oh, there's Natalie. Excellent. So this has been a whole week of adventures when it comes to technical issues. So Natalie, I am going to turn it over to you.
Wonderful. Thank you, Rob. Sorry about that. And I just want to give everybody a warning that my dogs are you'll probably be able to hear them in the background. I apologize for that. Hopefully these earphones help block that noise. So let me go ahead and share my screen so we can get this presentation going. Rob, can you see the slideshow?
Perfect.
Perfect. Wonderful. So again, my name is Natalie Alcorta. I manage the Information and Resource Center at the Age of Central Texas. Some of you may have had one-on-one consultations with me. I provide services, personalized services for individuals who are just looking for information and resources. I can spend some time with you, figure out what exactly your needs are, and direct you to the appropriate agencies and resources that are in the community. So this is a little bit about the Information and Resource Center at AGE and what I do. As I mentioned, I help individuals navigate information and resources. I can do that over Zoom, by email or phone. We are currently not meeting in person right now, but you will definitely hear about that if you receive our emails for whenever we do start meeting in person. I also help with planning conferences, just as this one that you're attending this week. And I also provide free seminars to the community. They're usually on a Saturday morning. And we have different topics that we cover from hospice and what is hospice to Medicaid and Medicare, to activities to do with a person living with dementia. So we have a range of seminars that we put on. Another program of Age of Central Texas is our Health Equipment Lending Program. I want to mention this too because this is a free program to the community, anyone of any age. We provide free durable medical equipment, also known as DME. So as you can see, we have wheelchairs, transport chairs, rollator walkers. Those are the ones with the 4 wheels and a seat. We also have shower chairs and shower benches. And we also provide once a month incontinence supplies if that's something that you're in need of. We understand that incontinence supplies are very expensive and we want to help with that cost by providing you with 2 packages of adult disposable underwear. We also have bladder control pads, bed pads, wipes, and gloves. So you can see that's our contact information, and you'll receive all of this information after the presentation. But we are only providing our services by appointment only at the moment because of COVID. We're still keeping everybody safe. So if you're interested or in need of any of the items that are listed, please give our office a call, leave a voicemail. We are receiving a lot of calls right now, so we ask that you just be patient as we get to your call, and we promise to return it. You can also email us if you are interested in receiving an item, and we will set you up with an appointment, and then you can come pick it up. It's pretty easy. Another program we have is our Caregiver You program, and these are evidence-based classes that are taught out into the community, and these classes are free to you. We have 2 classes that are specific to family caregivers. One is our Powerful Tools for Caregivers class, and this is a class that is going to help you learn how to balance your life while caring for someone else, because it can be a lot and it can be overwhelming. It's also a really wonderful opportunity to be in a small class setting and also network with other caregivers. Our next caregiver class is called Savvy Caregiver. And this particular class focuses on the caregiver who is caring for someone living with dementia. It's a very different type of care. So we talk a lot about communication techniques, how to be organized, understanding what dementia is, and the importance of learning the specific diagnosis. And again, it's a small class setting, so you get to meet other caregivers in a similar situation. Again, these classes are free. You just find the class that you're interested in attending on our website, you register for it, and you show up. Another class is our Matter of Balance class, and it's a falls prevention class. So really anyone can attend this class. And they will talk about, they'll give you homework to take home and identify some areas in your house that might lead to a fall. What are some risky areas? Is that pretty rug in the middle of the walkway a risk? Or would it be safer to maybe remove it? So we provide that class, again, that's free. All of our classes right now are being held via Zoom. So we are able to still present these classes virtually. And again, you will know whenever we do open up to in-person classes if you receive our emails. And you can always just check our website as well. One thing I do want to say about these particular classes is that because of COVID and because spending a lot of time in front of your computer and on Zoom can be exhausting, we have created a condensed class for each of these Caregiver You classes. So instead of a hour and a half, you can attend an hour and a half class for over 6 weeks. You can attend a 2-day class that's an hour each, and it's still a lot of the same information. It's just it's condensed, and it doesn't require you to sit in front of the computer for long periods of time. So let's see. I want to talk to you a little bit about virtual connections. This is a new program that we have at AGE, and it was created when the shutdown happened. We were once meeting in person with our Memory Connections program, which then transitioned to virtual connections. And this is a virtual service for older adults and care partners. It's a tailored service that is based around activities and support, emotional support. So there is an intake and an assessment that goes along with this, just to see where your person is cognitively or where you are. And then we match you up with the appropriate activities that would be best for you. And this particular program does have a cost. It is a membership fee of $100 per month, but you have daily and weekly access to activities that are virtually presented, and also you have access to support groups. And I do want to mention that this is, we have a lot of individuals who are living with early memory loss who attend our programs, and their caregivers. So then we have our Thrive Social and Wellness Center, which is our day program. We have 2 locations. We have one in Austin and one in Round Rock. This program operates Monday through Friday, 7 a.m. to 5:30. And this is a place where individuals who are living with physical or cognitive challenges can come during the day. They're provided with 2 meals and a snack, a ton of socialization and creative activities. And it's a safe place to be. This particular this particular program does have a cost. It is $70 per day at a private pay rate. We do accept Medicaid. We accept VA benefits and also long-term care insurance. If for any reason our $70 a day is too much for your particular family and you are not currently receiving Medicaid or VA benefits, we still want to talk. We want to be able to help you access this program and see what we can do to maybe discuss that cost. Okay, let's see. So this particular, I'm going to go ahead and transition into some information and resources because I know everybody's here for that. I want to mention this guide. We have prints of this at our age building, and I know a lot of agencies around the area have hard copies of this particular resource guide. But this guide is Caregiving in Central Texas, a community resource guide. And it is a big collaboration from all of these agencies around the area who we work really hard to put this together for you. I know it says caregiving, but this particular guide has so many resources for older adults and caregivers. And after this presentation, after I finish my slideshow, I will show you exactly what this looks like. If you want any copies of this, I encourage you to contact AGE and we can get this scheduled for you to pick up. Again, we have hard copies of this particular resource guide. Another really important resource guide that I want to share with you today is the Transportation and Senior Ride Guide. And this is through the Office of Mobility Management. I mean, you can access an electronic copy of this at mytxride.com. And I will also make sure that this is sent out, an electronic version is sent out to everyone. But we also have hard copies of this particular transportation guide. This guide is incredible. It talks about how to access CAP Metro, the steps that you need to take, offices that you need to contact, how to access a disability parking permit, which particular offices to contact based on your particular area. And it also has free services listed here in our area, such as like Drive a Senior, Senior Access, and then some rural resources as well, like carts. So, and again, after this slideshow, I will show you what this ride guide looks like. So you have a visual of it. And then again, if you would like a hard copy of this, you can connect with AGE or you can also just access the electronic version that we will send out to everyone who has registered for this event. So another really important resource I want to share with you and just remind everyone of is 211 Texas. You dial 211 if you are in need of any resources. They will connect you to nonprofit organizations and other government agencies. They are bilingual. They can provide a referral service. And this is free to you, to anyone. So I encourage you to, even if you want to call and just learn about what they offer and how they can help you, that's helpful too. But 211 is a wonderful resource that sometimes I just like to remind people that it is there and it's super helpful in connecting individuals and families to resources and services in our area. Another wonderful resource I want to share with you is Findhelp.org, and it was previously known as Aunt Bertha. And this is also an online database that you can use to search for local resources. It'll ask you certain questions like which particular zip code are you wanting to search in, which city, what exactly are you looking for? Are you looking for housing? Are you looking for food pantries, financial assistance? You can put that into their search engine, and it will bring all of the services that are closest to you or in the particular area that you're wanting to search. And then it brings up like all of the contact information for the specific agencies. So that was Aunt Bertha, which is now findhelp.org. Another, give me 1 second, I'm going to move my little bar here. So another wonderful resource that I want to share with everyone is, I get a lot of calls from individuals who are maybe wanting to move from independent living to an assisted living, or it's a family member or a friend who's trying to find a residential care community or a memory care community for their person. And there are so many here in the area, and it's overwhelming, and they call and ask, where do I start? How do I find these places? How do I read reviews? So I wanted to include this to share with you all that there are several different ways to go about this. One of them is through the Texas Health and Human Services Long-Term Care Provider Search. You can, they have a wonderful search option for specific zip codes and cities, and you can type that in, click on the type of care community that you're interested in locating, whether they accept Medicare, Medicaid, and it'll populate the search. Another really wonderful resource here in our area are senior living advisors, and these particular advisors are free to you. And what they'll do is they will help you, again, find the best place for you or your person. They will sit down with you and talk about cost, location, and the needs that you're looking for. And they will help you, just figure out where are the best places to go for my particular situation or for my person's situation. And they're such a wonderful resource. Age of Central Texas and lots of other agencies around the area are able to provide you with this type of resource. So if you are interested in that, you can reach out to us, or again, other agencies in the area can help as well. I definitely give out the Medicare.gov website to individuals as well. This is a really great way to look at reviews and ratings and compare care communities. So that's a really helpful website. So let's go move on. Let's see. My PowerPoint is not, oh, there we go. So I want to just mention also affordable housing and how here are some, here's a helpful resource when it comes to locating. I do want to mention that a lot of these resources that I'm sharing with you right now are it's a where to start. Here's a good resource to start with. There are lots of other resources that are not included in this particular presentation due to just time. So I encourage you to reach out to AGE and other, the Aging and Disability Resource Center in the area Agency on Aging as well, to learn more about resources that will benefit you in your particular situation. So this is an affordable housing locator through the U.S. Department of Housing and Urban Development. The website is right there. And again, you'll receive this after the presentation. This is an interactive map that you can manipulate. So that you can type in like Austin, Texas, and it'll pull up on a map affordable housing complexes in our area. It's really helpful. It pulls up, the contact information for the particular housing development, and it also gives you the option to find a HUD office near you, find the local public housing authorities, find homeless resources. And also there's an option to specifically search for affordable elderly and special needs housing. So I encourage you to check this out too. I'd like to mention Meals on Wheels as well, because Meals on Wheels does not just deliver meals. They have lots of wonderful other programs. They have an in-home care program that is both private pay and also Medicaid. They accept Medicaid benefits. They also you have to qualify for all of this, and there's a process. So I encourage you to contact Meals on Wheels if any of these services are, if you're interested in learning more about them. They do provide some home repairs. They have a wonderful PALS Pet Assistant program, which can help older adults who need some care for their pets. That can be due to hospitalization or a recent fall, or just if you need some assistance with your pets, they are a wonderful organization to call. And then grocery delivery for older adults. So I wanted to mention them because when I usually talk about Meals on Wheels, people are like, oh, I didn't realize that they also have it in home care. So again, if you want to learn more about some of the services that I mentioned, please give Meals on Wheels a call. Another wonderful organization here in our local area is Family Elder Care. They have a guardianship program, and this is for individuals who maybe want to not give the responsibility over to their family for their particular care, and also this is for individuals who maybe you do not have any immediate family in the area, and you need someone to just look over things when it comes to paperwork and bills. They have a wonderful program. They also provide in-home counseling, Lifetime Connections Without Walls program, and this is, I believe, over the phone and their activities. They also can help with money management and service coordination. So I encourage you to, again, reach out to Family Elder Care if any of these programs interest you. I'd also like to mention Nami Central Texas. This is a wonderful organization, and they provide mental health services, resources, and education. They offer support groups and free classes. So again, connect with them if you would like to learn more about mental health services or support groups, or just check out what upcoming free classes that they have going on. I'd also like to mention, we have definitely several other agencies and organizations here in the area that provide legal services. Texas Rio Grande Legal Aid is a wonderful organization that I just wanted to mention. Again, this is just a you can start here. If you would like other options, I'm happy to provide that to you after this presentation offline. I can send you a list of really wonderful, affordable legal aid resources here in the area. Another really great resource is Aarp Texas. Their online resources are incredible, and they have tons of virtual programs and seminars. They're wonderful when it comes to caregiver resources as well, and also can provide community referral assistance and one-on-one assistance to individuals. They often will also present at our conferences and are just a wealth of knowledge and support. The Alzheimer's Association is also another wonderful organization to reach out to if this particular organization is for you or your family. They also have lots of support groups and resources online, programs and conferences. They have a hotline as well that is incredible, and I know plenty of caregivers who have utilized their hotline, and that will be included in the resources that you receive. Alzheimer's Texas is also really wonderful when it comes to resources and support groups. Here's their helpline. And again, they're wonderful, and they can also submit community referrals. So they will help you get connected to the right resources. So another way to access information and resources that I wanted to mention are through support groups. Joining a support group specific to if you're living with a chronic illness, I encourage you to find a support group that have other individuals who are living with that particular chronic illness. Or if you're caring for someone living with dementia, join a support group with other caregivers. There's so much information that is passed back and forth between caregivers, and information that's just it's so helpful. And you also get to meet other people who are in a similar situation. There's a lot of benefit from support groups, and also I facilitate a couple through Age of Central Texas, and if you are just wanting to observe, you are welcome to come. There's a lot to learn from just observing and listening to other people, and you don't have to, or you're not forced to share yourself. So you are always welcome to just come and sit, listen, and take what you need from that particular session. Counseling support, seeking counseling, just really for any particular situation that you're in. If you're maybe struggling a little bit with caregiving, maybe you have a recent diagnosis, there are affordable ways to access counseling support, and that can definitely be shared. We have a list that we like to send out to individuals who are seeking that specific type of assistance and information. Geriatric care managers, I want to mention, are wonderful. This is somebody that they do have a cost, but this is someone who can come in and manage your situation as a caregiver or as an older adult. Do you need extra help establishing services, coming up with a long-term care plan as you are aging or in your caregiving journey? They are the people who can help you with this and take a lot of that work off of your plate. So I encourage you, again, we have a list that we like to share with people. If you're interested in a care manager, just learning more about it, Again, I'm going to mention disease-specific organizations. If you are living with a specific condition or have been diagnosed with a particular disease, or you're caring for someone, Google those specific organizations, Google that and connect with them. We have lots of different agencies here in the area. A really wonderful Parkinson's organization. So I encourage you to search that. And if you don't want to search that, you can call us or call the ADRC or Area Agency on Aging, and we can help you connect, or 211, any of these resources that I've shared with you today to help you find those organizations. And then the last thing I wanted to just mention is to subscribe to email lists. I know that can be a lot sometimes, so when you get lots of different emails from people, but it's really helpful just to keep up with like conferences, new events. There's a dailycaring.com. They send out daily emails with just lots of different tips and tools and topics. And if that sparks your interest, click on it, read it. So I believe that is it for my slideshow. And I promised you all, let's see, let me get you back up on my screen. I promised you all I will show you the ride guide and the community guide that I mentioned. Rob, can you see this?
I can.
Okay, wonderful. So we'll start with the Transportation Services and Senior Ride Guide. This is what I was talking about, and we do have hard copies of this. This will show you exactly, it breaks it all down for general transportation information, senior transportation information. It has, I'm going to just scroll down. Lots of, driver's license renewal for older adults, how to access disability parking permits, offices to call. Like, it's just a wealth of knowledge all when it comes to transportation. And then I wanted to show you briefly, because let's see, is the Caregiving in Central Texas Community Resource Guide. And again, this is organized in a way that you can quickly go to utility services and resources, hospice, geriatric care management, support groups. It's all in here, and not just for caregivers. It's for anyone really, any older adult or caregiver in our area. So I just wanted to share that with you briefly. And then I also want to mention, I'm really happy to welcome, we have the Aging and Disability Resource Center here with us. We have representatives here from that agency. John is, I purposely left their particular agencies off of my slideshow because we have them live in person, and John will go ahead and talk about their agency. So I will go ahead and hand it off to you, John, so you can tell everyone about your organization.
Thanks, Natalie. Good morning, everybody. As she mentioned, my name's John. I work at the Aging and Disability Resource Center, also known as the ADRC. There are about 28 in the state of Texas. They're also all over the country. They're usually coupled with what's called an Area Agency on Aging, and at least here in Texas, they're based out of what's called a COG, a Council of Governments. So here in Central Texas, we're based out of the Capital Area Council of Governments, and we're just one of your partners in serving older adults, persons with disabilities, and caregivers. I'm going to go ahead and show my slide so that you all can follow along with my presentation here. So you might ask why there's two aging agencies at CAPCOG, the Capital Area Council of Governments, and maybe what's the difference between the two? With the Aging and Disability Resource Center, we're not limited by age. We're able to assist any individual of any age with a disability, their caregiver, as well as older adults. The Aging and Disability Resource Center of the capital area, as well as all ADRCs, are a single point of entry for individuals of any age or income to access maybe long-term services, support programs, and possibly benefits. Those options are always going to be consumer driven. It's the consumer's choice and dependent on their need. We serve as a no wrong door. And that no wrong door means that you might come in with a question about, say, transportation, but also need some assistance financially. We'll make sure that you're connected to all the resources for the situations that you're needing resources in. Various people give us calls, older adults, persons with disabilities, caregivers, family members, friends, neighbors, also lots of helping professionals. Each council of government covers a region, and in our region we cover 10, Travis County being one of them. If you are seeking information for yourself or someone you know about local resources, maybe things that can help you with home repairs or ways to find care for your child, if you're needing information about getting help in the home or maybe financial assistance to cover your energy bill, maybe you're a caregiver who doesn't have access to respite and you need that support, we might be able to assist you there. We also have a program called Local Contact Agency. Most aging and disability resource centers are going to have that. And what that entails is being able to assist an individual who is private paying at a long-term care facility who wants to rejoin the community, maybe go live with family, maybe go live independently back at their house. We want to make sure that those individuals get the follow-up attention that they deserve and need in order to live independently once more and get connected to the resources that they need to be successful once re-entering the community. Some additional things that we can help with, again, that long-term care service. That's going to be through the Health and Human Services, although we can facilitate an application to get that personal assistance or homemaker service. We can also provide information on independent living and assisted living options. As Natalie mentioned, there's that great resource through Health and Human Services, the long-term care provider search. This is going to be a key way for caregivers and consumers alike to find information about those services available to them in their specific area. We're going to be able to cover specific resources and services that are designed for older adults, persons with disabilities, and caregivers. Being that we're based out of the Capital Area Council of Governments, again, we're in a unique position to also facilitate our programs, but also promote the services for the Area Agency on Aging and making sure that we get our clients as well connected to those services if eligible. We also want to make sure that everybody who is a veteran, maybe a spouse of a veteran, or a surviving spouse of a veteran, connected to those resources at the local level that's going to help them with what they're needing. Every individual who either calls, emails, walks in are going to be screened for these items here. Like I mentioned, we can help in accessing an application for long-term services at home for that personal assistance or homemaker service. And the application is for the Community Attendant Services Program. That service is done over the phone. In general, we would say that it takes maybe 30 to 60 days for Health and Human Services to come to a determination on that application. Some caregivers call in, or family members who are needing a caregiver call in saying they need a family member, specifically somebody they know, to be their caregiver and get compensated for providing that time and attention. This might be a program that can help with that opportunity. So if getting connected to this application, you can certainly speak with Health and Human Services about that question or call in directly and ask about that possibility. Again, this is something over the phone. So if you or someone you know needs access to this support, again, that personal assistance or homemaker service, this might be an application that works for you. Additionally, we're screening all callers for eligibility for Area Agency on Aging services. That might be for benefits counseling, might be for home repairs, minor home repairs, I should clarify. Everybody who is going to be calling in or emailing is also asked again, if they're a veteran, surviving spouse, or spouse. We want to make sure that they have access to the individuals who can help them with the services and benefits that are available to them. Additionally, our contacts are screened for something called Medicare Extra Help. And if you're not familiar with Medicare Extra Help, it are these 3 programs and others here. It might help in lowering prescription drug costs. It might help in assisting with the payments for premiums, co-pays, co-insurances, and deductibles of those Part A and B. It's also a way to make sure that the beneficiary who gets the Medicare benefits is keeping up with their personalized prevention plan. Every year, there are annual exams that are going to be covered through Medicare. And so it's a really great way to make sure that you're keeping on top of your health, your loved one's health, and making sure that you know about all the benefits that you have available to you. Something else that we can assist with locally is going to be with the Austin Energy +1 Financial Support Program. This program offers individuals who are clients of Austin Energy assistance with paying their bill. It does need to be for a residential account. We will need to speak with the account holder. But again, it's one way for the Aging and Disability Resource Center to assist individuals who are caregivers, persons with disabilities, or an older adult. We're just one of the +1 partners, and we can assist you a few times. And so if we assist you with the maximum time, no worries. We'll make sure that you're directed to the Customer Assistance Program at Austin Energy and also to their website where it shows a ton of other partners in the capital area. If you want to get connected, all you need to do is just give us a call or email. We won't need any kind of documentation, so please don't leave any confidential or private information. We want to make sure that you are connected to those customer assistance programs. And I understand this is for a Pflugerville conference, but just the way that these cities are built, some of you might be Austin Energy customers. So if this is something that's necessary, if it means that you might be not buying as many groceries because you want to be able to pay your electricity bill, hold off, give us a call and see if we can help you. We also want to be able to help the caregiver as best as we can through this lifespan respite program. Switching gears to another program that the Aging and Disability Resource Center offers. This is going to be something that assists the unpaid family caregiver who doesn't have access through their loved one's Medicaid program with respite services or maybe care assistance. They're not going to be eligible if they're already getting government or nonprofit respite services, but maybe if they've exhausted all their hours with that government or nonprofit, that indicates they're having difficulty accessing respite. That means that they're eligible for our service. Again, we are able to assist older adults, persons with disabilities of any age, and their caregivers. For this particular program, we do need to speak with the caregiver in order to move forward, and it's a very straightforward process. The intake maybe takes about 10 minutes. From there, we need to gather information on the provider that the caregiver gets to select. All that needs is 2 documents, and we move forward with issuing an award. The caregiver through this program is going to be able to select for that service to be in-home with a company or maybe somebody that they know. It could be at a daytime care facility or maybe at a camp. Lots of parents now are having their children come home from school, and this might be an opportunity to get that kid back out, socializing, meeting friends after a year, a very long year, where they weren't able to have that kind of experience. There is still funding available, and we'll make sure that you're able to connect with this program if you're interested. Some things to note when connecting with the Aging and Disability Resource Center. We will not be able to access your Medicaid cases or read any of the comments. We cannot provide you with for-profit recommendations because we're connected to a government entity. We need to make sure that we remain impartial and that you as the consumer have the choice in selecting the provider that best suits your needs. All services are available over the phone or through email. Documentation is never needed, but in particular cases, we might need some documentation just to corroborate some information. But in general, we're never going to ask you for your information or anything to be sent to us for any of our services. We're also, again, that connection as well with the Area Agency on Aging. If you do want to get connected with us, we have an 855 number that's going to route through Health and Human Services initially. Don't let it confuse you. You'll select option 1. You'll listen for the prompt to select that you need help with long-term services. Once you do that, you'll be informed to enter your zip code. Once you enter your zip code, that's what's going to get you connected to the Aging and Disability Resource Center that covers your particular area. Again, there's 28 in the state of Texas and more all over the country. If you prefer emailing, there's the adrc@capcog.org. When connecting with us, we want to make sure that your information is kept as secure as possible. So please don't leave any private, confidential information like your social security number or date of birth. Make sure to just leave your name, a way to contact you, and a brief message. And if possible, let us know when you can be reached. Understanding that as caregivers, as individuals seeking assistance, you're on the phone a lot. You might be missing calls. We want to try to avoid that. So try and let us know when we can reach you so that we get you on that first try and use your time as best as possible. Again, our services are all offered over the phone. So while walk-ins can be allowed, they're really not necessary. Some other things also to look out for. I do want to mention that we will have a newsletter coming up. That newsletter will be accessed at this website here, www.capcog.org. That's a way to get information on resources and upcoming events offered through Capcog. I also want to let you know that we're working on getting a public-facing database. Again, you're spending a lot of times on the phone looking for that assistance. We want to make sure that it's as easy for you as possible. So once that's up, you'll be able to go to www.capcog.org, review that information for yourself as well. Again, that's our contact information. I'll be on after the call if you have any questions for me or for the agency, and we'll make sure that you get the answer that you're needing. I want to thank you all for your time and attention this morning, and I hope you all continue to have a great day. Thank you.
Thank you so much, John. That was so helpful. And I hope everyone also took a lot of information from the Aging and Disability Resource Center. We also have the Area Agency on Aging here with us as well, Rhonda Thompson. And I apologize, all of our names have aging in them, so it's a bit of a tongue twister. But Rhonda is here. She is a representative of the Area Agency on Aging. Thank you so much for being here. I do have a video. We have a video that we're going to play that will describe all of the programs and who the Area Agency on Aging is. So let me share my screen. And if you will let me know if you cannot hear the audio, just holler at me. I'm going to make sure everyone can hear this.
The Area Agency on Aging of the capital area has provided quality services to support and advocate for the health, safety, and well-being of older adults and their caregivers in the 10-county capital region since 1981. All our services that you see listed here are provided at no cost to individuals. We do not have income eligibility requirements, but we do try to reach target populations that include low income, rural, and most at risk for institutionalization. Most people can be assisted over the phone. Information referral and assistance phone line It's where you can speak with our trained specialists to connect you with Area Agency on Aging services and supports. They can also provide information on local resources as well as additional information. One of the programs that few people realize is provided by the Area Agency on Aging is our nutrition program. The AAA is a source of funding to meal providers across the 10-county region who serve nutritious home-delivered meals and congregate meals 5 days a week to older adults, many who may go without a midday meal without this service. The Benefits Counseling Program is a group of experts who can help you navigate the maze of public benefit programs, answer questions, and assist with the application process for Medicare Parts A through D, Medicaid, Social Security, and supplemental insurance. Our Care Coordination Program team assesses the individual's needs in order to link them to a full range of in-home services, such as homemaker, personal assistance, minor home modifications, and emergency response systems. Our Caregiver Support Program supports family members who are caring for adults 60 years or older, or a primary caregiver for an individual of any age with a diagnosis of Alzheimer's or disease-related dementia. Also, grandparent or non-parent relatives age 55 or older with formal or informal custody of a child age 18 or younger. The Ombudsman program has specially trained advocates for residents of nursing and assisted living facilities. They help develop positive relationships with residents and the facility staff to ensure issues are resolved in a positive manner and that residents' rights are preserved. Our Health and Wellness program has workshops that provide tools to maintain health and safety for sustaining independence. All programs are evidence-based interventions that have been proven to help older adults to improve their quality of life for the long term. Check our website for upcoming workshops. The Aging and Disability Resource Center of the Capital Area is a single point of entry for individuals of any income or age to access long-term services and support programs and benefits. Please contact us for more information about rewarding volunteer opportunities at the Area Agency on Aging of the Capital Area. Thank you so much for your kind attention. Please contact us at the numbers and websites listed here. Well, thank you to Natalie and Rob and with Age of Central Texas. It's always exciting to partner with y'all and be a part of this. And I did see Bob from the DFW area. I want to say a shout out. I'm from originally from Colleyville, Grapevine. So hi to everybody back home. Anyway, the Area Agency on Aging and the ADRC, Aging and Disability Resource Center, are housed together. We're sister agencies. We're under the same director and also we're part of CAPCOG. And so that's why that extra slide was there. John, you did an excellent job on filling in all the blanks. But I just want to mention, you know, COVID has affected all of us. And so just a couple of things I want to mention. The congregate sites are slowly opening. Some are, but frozen meals are still being delivered and they're not quite the meals that they had pre-COVID, but things are slowly coming back. And so we're excited about that. And again, we have 10 counties that we serve. There's an Area Agency on Aging in every region, every county of the state of Texas. I know some of y'all are not from the capital area. And there's also nationwide. So if you know someone or have family members in another state, there will be an Area Agency on Aging and Aging Disability Resource Center in that area. So, you know, you can always have them reach out to that, and that just type in Area Agency on Aging or ADRC and put in that county, and that information will come up. Anyway, so we work with Meals on Wheels of Central Texas, Combined Community Action, Opportunities of Williamson and Burnett County, and Hill Country Community Action with those meals and congregate sites. Just a couple of extra things on benefits counselors. We have staff that is their job. That's all they do is work on Medicare and other related benefits. They become very well qualified and experts in that. They can help with any appeals on Medicare, excuse me, plan comparisons, Medicare Advantage plans. There's some fraud. They do a lot of fraud prevention, and they're hosting a scam webinar, scams webinar that are out there. And I don't have that information, but I can certainly send that to Rob and Natalie, and they can forward that out. It's a free seminar. All of, all of our services are at no cost to the individual. So give us a call, email us, anything like that. Additionally, benefits counseling, they do advice and counseling, document preparation. They can help one-on-one assistance with that, and they can represent, be an advocate in any appeals process, things of that matter. The Ombudsman program was mentioned. Ombudsmen are advocates for nursing home residents, assisted living residents, and family members of the residents. They can help with residents' rights, quality of care, quality of life, things like that, family issues, problem solving. Discharge questions, they have been very busy with COVID, and they are able to make visits at this time in nursing homes. They do outside visits, and I'm not sure all the other types of, if they're inside or not, but they have the full PPE, personal protective equipment that they have in their vehicles when they go do the visits. Our health and wellness classes, I wanted to mention, we have an additional one we started. It's called Building Better Caregivers, and it's amazing. It touches on managing fatigue, staying healthy, getting help, working with healthcare professionals. All of our classes, all 4 of our classes have gone online, and we are doing the full 6 weeks with those classes, 8 weeks for Matter of Balance. But it's been really good in continuing that. We were able to start that up in April, right after everyone went out in March. And it's been helpful for people kind of isolated to be able to have some contact. And so that's been really a positive thing. Care coordination, and Melissa Crawford is on the call with us today as well. She's the program manager for care coordination. That is services to people age 60 and over. And that's, as John mentioned, that's the difference between the Area Agency on Aging and the Aging and Disability Resource Center. We started age 60, and they have no age restrictions. And we started age 60 because the Older Americans Act tells us that's what we need to do. And so again, it's at no cost. All the services are at no cost because you've paid your tax dollars for these services. And so these are your tax dollars coming back to serve you. Excuse me. Target population, individuals at risk, greatest economic need, social isolation, low income minority, resides in rural areas. And we have rural counties on both sides. We go to Blanco, Llano, Burnett counties, and then Williamson, Travis, and Hayes. And we have Bastrop, Lee, Caldwell, and Fayette. So we're on both sides of this major corridor of 35. And some of these counties are pretty rural. Some of the services we can offer: homemaker, light housekeeping, laundry, meal preparation. What we do is we contract with home health agencies and other providers, and then we will pay for those services. One thing that we've found that helps too, if there's not a home health agency in that area, especially with the rural areas, or perhaps someone knows of someone, typically not a family member, but knows someone who is able to do this type of work, we can provide a voucher program for that to pay for those services. Personal assistance, bathing, grooming, toileting, dressing. We also have emergency response, that the personal electronic alarm system. If someone falls, we can help with that. Health maintenance, we can assist with purchasing items that promote the health and safety of a consumer. Chore maintenance, that's for those heavy duty household chores. Income support, and this has been a really big one with COVID. It's a one-time payment assistance to a third-party provider for services and goods that support the basic needs of the individual. Residential repair, we can help with minor repairs, a grab bar, a ramp, things like that that are essential for the health and safety of the consumer. Mental health services, We have access to counseling to support and improve the mental health, the emotional well-being of an individual. And we all have been dealing with that in the last year and a little bit. Medication screening, that's another service we can offer. It's a customized report from a licensed pharmacist, which includes informative tips and alerts of potential negative interactions. So sometimes people end up taking two different medications for the same thing. It could be over the counter, prescription, things like that. And so our pharmacist will review all those, anything you put in your mouth or on your body, creams, lotions, anything like that, herbs, supplements, and we'll look at all of that list and write a report that is pretty understandable. It's not in scientific language, or it's pretty basic to understand it and follow it. And we've had folks who have been informed, maybe you need to talk to your healthcare provider about this medication because you've been on it for a while, or this one interacts with this one. And so sometimes people don't always realize that. So it's just an extra help when you talk to your healthcare provider. Home delivered meals, we mentioned that. Frozen meals to provide food insecurity in certain rural areas. And right now they're not all frozen. Some are frozen, and then there's some shelf stable as well. Caregiver support program, that can be a primary caregiver, services offered to a primary caregiver 18 or older, caring for an adult 60 and older. So if someone's caring for an adult 60 and over, regardless of age, 18 and up, then we might be able to provide some services for them. Or an individual of any age diagnosed with Alzheimer's or disease-related dementia. We also have a family caregiver, grandparents, 55 and older, who are taking care of a child or children 18 and under. So our grandparents, if they're 55 and older, or they could be a non-parent relative, then we might be able to provide them some assistance as well. Or an individual who cares for a child, or an individual with a disability, including parents. So the caregiver support provides all the other supports that we mentioned before, plus they have respite. So they can, a brief period of relief or rest from caregiving responsibilities. They can go get a haircut, go have, meet a friend for coffee, things like that, knowing that their loved one is provided for, they're being cared for by someone that we've sent into the home. Caregiver education and training to assist the family in long-term care planning. Caregiver information, we have all kinds of presentations, literature, seminars. We, joining with AGE, offer an annual Striking a Balance Caregiver Conference, and our 20th Caregiver Conference is in August. So that's exciting. Pay attention, watch for details on that. And I'm excited because it's going to be a mix of online and in person. We're actually going to get back together in person, and so that'll be really exciting. We always have volunteer opportunities. Benefits counselors, we're always looking for volunteer people we can train. We would train with, for all of these, ombudsman, we train ombudsman to go into nursing facilities and such. Health and wellness facilitators, we're always looking for people we can train who would be able to lead those classes, preferably in our rural counties. So there's all kinds of opportunities and services that we offer. I did want to mention also that we have our benefits counselors are sponsoring an estate planning webinar next week, I believe. Excuse me. And again, I can get that information to Rob and Natalie after this so they can send it out. I think that's all that I have. If there's any questions, I think this is the time that we're going to do that. So that's all I got.
Thank you so much.
Terrific. Thank you so much, Rhonda. Thank you, Natalie. Thank you, John. Great information. And I want to point out just one more resource for everyone, and that is our co-host this morning, the Pflugerville Community Church. They have a lot of tremendous resources and a amazing seniors ministry that they have in the community. You don't have to be a member of the church to access it. It's open to everyone. And in particular, they have a program called Health Nuts. That is their exercise program and healthy living program that they have been doing for a number of years. Of course, when COVID hit, they weren't able to do them in person, so they went to a virtual setup. And so they have a lot of live Zoom weekly presentations they do. They've also recorded them and they're all on YouTube. So there are great opportunities there. They also have have started doing line dancing. So great fun opportunity at that. And they also have a healthy cooking segment that they have started. So you can go on to YouTube and just Google for Pflugerville Community Church, or if look in your program, remember I mentioned that there is a whole page on all of the great resources at the Pflugerville Community Church. We are so very happy to be partnering with them again for this 6th year to bring you all of this wonderful information, because May is Older Americans Month. And so we planned this on purpose so that we could bring you this great info. Got some questions from folks in particular, and Melissa Crawford is joining us, as Rhonda mentioned, from the Area Agency on Aging. The question number one is, let's review, I know we mentioned it a couple times, but what are the age limits for accessing the resources? We'll start with Area Agency on Aging. What are the age limits for the 2 CAPCOG programs?
Okay, Grande, you want to take this? Okay, so we have the care coordination program for individuals, and that is for individuals 60 and older. And then we have the caregiver supports program. So there's actually 4 categories there, but for the most part, it's going to be caregivers age 60 and older, caring for, I'm sorry, caregivers, not 60 and older, for individuals caring for someone that is 60 or older. They could also be caring for someone of any age that has Alzheimer's or other dementia. But then, like Rhonda was talking about with the caregiver program, so that could be for a caregiver that is 55 or older, and they are caring for an individual that's 18 or younger who the parents are not involved. So it's really grandparents, but it could be another relative that's not the parent. So it could be an aunt, it could be an uncle, it could be someone else. But then there's also caregivers that are 55 and older caring for an adult child that has a disability. So depending on what the situation is, it could be 60, it could be 50, or it could be the caregiver can be 18 and older, caring for an older adult.
Great. And Natalie, what about Age of Central Texas? Are there any age restrictions for services?
I don't believe so.
Yeah.
No. Like I mentioned when I was talking about some of our programs, there is an intake process. There's not a specific age. So our Thrive Social and Wellness Center has their own intake process, and our Virtual Connections has their own. And it's really, we're assessing cognitive abilities, and just making sure that our program is going to meet the individual's needs and is best for them. Our help office, anyone in the community can access our durable medical equipment or incontinence supplies. The only information that we ask for is contact information and some demographic information, but that's it. We don't need to see any kind of financial statements or anything, and we do not ask for the items back. So you can keep it for however long you need it. And if you have someone that that can benefit from durable medical equipment, pass it on to them or bring it back to us, and we'll connect that particular item to someone else in the community. I did see a question come through about our Thrive Social and Wellness Center, which is our day program, and if we are open. Yes, both locations are open. We opened up in October. We are operating at a limited capacity just to make sure that everyone is able to still social distance. And we still have our safety protocols in place. And so, yes, we are open. And if you want to inquire about that program, feel free to contact us, and we will connect you with the program director.
Wonderful. Yeah, with Age of Central Texas, our programs, our conferences, our Caregiver You programs, everything is no age limit. And the main difference is because of funding. The Area Agency on Aging and their programs are federally funded. It's pass-through money from the Older Americans Act. And because of the federal funding, there are some restrictions on how that money can be spent for services. With Age of Central Texas, we are a homegrown nonprofit organization. And so our funding comes from community support. And so that allows us to serve anybody in the community. And as our founder said, everyone is aging. And so that's why we're able to serve the full community where there are some restrictions with Area Agency on Aging and their services. We had mentioned the caregiver guide. Natalie showed you what that looks like. And we have that guide available on the Age of Central Texas website. I put the link into the chat box if you want to look at that. We're also going to send you the direct link along with all the other resources that we'll send you at the end of all of our sessions. But it is available as a PDF. You can always just go to the Age of Central Texas website, click on Caregiver Resources, and you'll be able to find it there. Speaking of resources, we had a question of what is available in the Milam and Bell County areas. Age of Central Texas serves just the Travis, Williamson, Hayes, and Bastrop counties. But I know that with CapCog, you've got a larger reach. So what services are available for both older adults and caregivers that are outside of this Travis County, Williamson County, Bastrop area?
So there will be an area agency on aging in those counties. All you need to do is put that in a search and put area agency on aging with the county. So Bell County, I think that's just north of us. Mm-hmm. And so that'll be Central Texas. Melissa, you might need to help me out. I don't have my map behind me. It's at the office that shows me all the area agency on agings. But there will be one there, and I believe Waco might be where that one, that region is located, the main office. But yeah, or you could, if you don't have access to the internet, give us a call. You can call our office. The number is 512, and Rob, I'll give you this, 916-6062, and a friendly voice that belongs to Susie will answer that call and can help you find whatever, wherever that area agency is located. And there's also, you can also go to Elder Care Locator. That's another resource if you're looking for someplace out of state. You know, we would look it up for you, basically. You know, okay, tell me what state, tell me what county. It's better if we know the county instead of the city, because it's just better that way for us instead of having all these different cities come up. But if we know the county, we can certainly call, you know, look that up for you, because, and I'm sure the same with the ADRC. I don't want to jump on your thing, John, but
no, if you all do have internet access, you would just go to your preferred search engine. You type in find an ADRC followed by HHS, and that should get you that link. But what you're going to have to do is just click through each of those. Some of them are named after the county, for example, Bayer County ADRC, but something called, say, Golden Crescent ADRC. All of them are going to list the counties, but you will have to click through to find the one that has the phone number, direct phone number, and the general ADRC, as well as the address for that physical location. So again, find an ADRC followed by HHS.
And the thing about it is we all have the same core programs. It's just a little different flavor depending on the location of where it is. But we all are mandated by legislation to have the same core programs. So all the programs that we mentioned will be offered in some form or another wherever that person would be located.
Yeah, and as Rhonda mentioned, you can always contact either Area Agency on Aging, Age of Central Texas, actually any of the resources that we have presented today. They'll help you find whatever it is that you need in terms of services. And if it's the middle of the night and you're looking for something, you can always just Google Area Agency on Aging and the town that you're looking for services, and it'll pop up and show you which one is the closest to you. As Rhonda mentioned, there are area agencies on aging in all of the major cities around the U.S. The idea is that every square inch of the U.S. is covered by at least one area agency on aging. So those services, again, are your tax money. It's the money that you've already paid for. So they're available throughout the U.S. I know we've got a lot of folks who are not from the Central Texas area joining us today. So that's a good first place to look, is your area agency on aging in your area, and they can help you find resources that are available to you. Speaking of resources available to us, we had a question about balance classes. We were talking about falls prevention classes that both our organizations offer, wanting to know if there's anything in Georgetown that is available.
Georgetown, I don't know. We have classes starting, matter of balance classes starting in June. I know there's 2 different classes starting in June. You know, we're I think those are still, they may be online still, but reach out to us. You can call and say, hey, you know, what's in Georgetown, matter of balance, because like I say, they may, if they're online, any place in our region can join.
And the same with Age of Central Texas. We have falls prevention classes that are online as well, that are happening practically every month. And so anywhere in the world that you have access to Zoom, you can grab those. Got a question, couple questions about caregiving. And one in particular is funding for long-term care. You know, this is always a big question we get a lot. And are there resources available in the area to help with funding for long-term care?
John may be better.
I was like, I just muted myself. Yes, so you might remember that slide that had that kind of big blue bar at the top, said Community Attendant Services Program. That's just one way to get clients connected over to Health and Human Services that are looking for that way to remain independent in the home, getting connected to that personal assistance. Maybe it's just some cooking, or maybe getting around the house, maybe needing assistance bathing, or just making the bed. That is an application for individuals who are seeking to remain independent, possibly, again, have their family member be that provider. So we can help you with that. Certainly if you call in through the Area Agency on Aging, or if you call in through our 855 number, that's just one way to get connected to that funding. HHS is broken up into regions, so we'll make sure that you have the number to follow up with as well to talk about that application or learn more about eligibility too.
And then I just want to add that that's a good time to be contacting, of course, the Area Agency on Aging as well. With the respite care, we can provide some assistance in many cases to that caregiver. It allows them, yes, that break from their everyday caregiving activities. And a lot of times that time is used to work on their long-term care plan. You know, what's the next step? A lot of times we can provide them with education if they're caring for someone with Alzheimer's or dementia. That's going to aid them in that process by providing that information that they need to know, what is my tomorrow likely to look like, and what do I need to start working on, what needs to be in place, what conversations do I need to have, who do I need to start talking to, what do I need to start researching. So getting some short-term temporary assistance through the Area Agency on Aging with things like respite and caregiver education is a good place to start.
Yeah, and I'm glad you mentioned that. I'm sorry, Rob. I'm glad you mentioned that, Melissa, because I didn't mention it when I was speaking, and it was probably in the video, but our services are short-term temporary. So, you know, if you're looking for something long-term, that's not us, but we can help you. As Melissa says, we can help with that. And John, we can help with that process. But our services are short-term or temporary short-term, which means, and Melissa can jump on this, but that means like 8 to 10 weeks or 10 to 12 weeks. It depends. I mean, and that's an average. It could go shorter, it could go a little bit longer, but they are short-term temporary. And we just have to, we do let folks know at the beginning, and we have to remind them a few times in between that, you know, these are short-term temporary services.
Short-term, but it's just such a valuable service and a valuable space of time to do so much planning and thinking and reaching out when typically there's no time to do that. I don't know where to start because I'm constantly engaged with my individual, with my loved one, and I don't, you know, necessarily want to take away from that, nor do I have somebody else in the home picking up some of these other pieces. So if we can pick up some of those pieces, you have more quality time with your loved one, plus time to do this long-term care planning, then we want to be a part of that.
And, you know, as we mentioned earlier, every person's journey is individual, and they have specific issues with their journey. And that's one of the opportunities that you have with both of our organizations, is that we can provide you that one-on-one. We'll sit down with you, talk through the issues, help you find the resources that are specific to your need, because what works for one person may not work with you. I also want to note that this is a topic that comes up a lot, and we've done a number of conference seminars on this very topic. So if you go to YouTube, Google for Age of Central Texas, it'll bring up all of our recordings from all of the past conferences we've had, and I know of at least 2 complete sessions we did on how to pay for long-term care with area experts. So there are videos available right now for you to look at that have a lot of great information. Talking about long-term care, the question on is there any of the area memory care communities that offer respite on short-term for older adults who have cognitive issue like Alzheimer's or other type of dementia? Natalie, I'm going to throw this one to you because I know we get this question quite a lot.
Yeah, and Melissa and Rhonda might have an updated answer too, but yes, for sure pre-COVID, there are short-term respite opportunities at certain care communities. And I can help you find those particular communities, if that will, you know, take some of this work off of your plate. I'm wondering, Melissa or Rhonda, do you know if, I know of a few that were doing this pre-COVID, where you could take your person there for a weekend or a week. I know that you all work with respite as well. Do you know if that has opened up?
I do not know right now, John. I don't know if you might know, because I think y'all also do like the lifespan respite and y'all do vouchers. I don't know if you're currently doing any vouchers in facilities.
We haven't gotten any yet, but it's certainly up to the caregiver to decide where that care takes place. A lot of times we will provide that caregiver with that Take Time Texas website. It's made by Health and Human Services, and that Take Time Texas website will show both providers, companies, but also facilities. So that's one way to maybe find that facility and then access that respite service either through any of our agencies and utilize those hours. It's there for you to use.
And I don't know, I don't want to add more work to our ombudsman, but sometimes they're aware of what's happening in the facilities. And we're shorthanded. We are in need of staff with the ombudsman, but they know, you know, who's open, you know, and what's going on with facilities. So the ombudsman, and that's actually a state program as well. So I don't have the, let's see if I've got the contact information for them. So, you know, just reaching out to the, I don't have that in front of me, but the ombudsman would have information, might have information. So you could actually call the state office, state ombudsman office, to see what would be available, you know, if you're not in this area or any part of the state.
I'd also like to just add that this is also a really wonderful opportunity for you as a caregiver, if you're joining us as a caregiver, to establish a relationship and connection with a community care setting for your person in case of an emergency situation. You already have all the paperwork and your person's familiar with that particular care community, and they can go there in case you have an emergency. But I encourage you to reach out. I had a list that I was sending out pre-COVID a lot. So I can update that for you and get that to you.
And as we've noted, COVID has changed a lot of the ways that all of us operate, not just our organizations, but the industry as a whole. We know that things are starting to open back up finally, and that's fantastic, but there's going to be some ramp up for a lot of us to get back up to speed. So for all of the organizations and all the resources we've shared with you today, be aware that they may have some restrictions on the services they're providing just because they are not up to speed just yet to be back to full capacity. But anytime you need any assistance with any of these things, if you're looking, you need some respite, give either of our organizations a call. We'll help find it for you. We'll help you with the funding for that. We'll make sure that you get that break that you need, because as we've talked all week when we talk about caregiving, as a caregiver, you need to have those breaks. You have to take care of yourself. It's not being selfish, it's being realistic. You have to put on your oxygen mask first, because you're not going to be any good for the person you're caring for if you're not taking care of you. And that's just the reality. We have time for one more question. We're running out of time, and we said we were going to end on time, so we're going to run 2 minutes over for this question because I think it's a great one. The question is there any financial assistance available for older adults who need help paying for their internet services? We know that the whole world went virtual, and that's where a lot of older adults have had to go to get their services. But for a lot of older adults, who are especially those on fixed incomes, it's a challenge for them. So are there services that are available to help pay for internet services?
Currently, the Area Agency on Aging is able to provide income support. It was always for utilities, not the phone and internet was never a part of that. But what we can do is we can look at something else that we could pay. Maybe we pay the electric bill. Maybe we can help with a portion of the rent if the person rents, which would free up financial resources that they can use to address that. And from time to time, we get other types of grants where we can provide financial assistance. So I would definitely give us a call and see what we can do to address that need.
And also there is a new program called Internet Essentials. You can Google for that. That is helping older adults to help pay for their internet. Also announced earlier this week is that Travis County has a funding program that is just launching for folks right here in the Austin area specifically, that's going to help pay for internet service for parts of this year. And so I'll make sure, Natalie, I send that information to you so that we can pass that along to everyone who joined on the program today. It's, again, it's going to be a short term for services, but, anything is better than nothing. So that'll be coming along as well. We are out of time, so I want to thank each of you so much. Thank you, Natalie. Thank you, Rhonda. Thank you, John. Thank you, Melissa. This is tremendous information, and we really do appreciate you sharing all this great info. Once again, anytime that you are in need of assistance, you can contact either of our organizations or contact the Pflugerville Community Church. They're a tremendous resource for you as well, and we will help you connect those dots to all of the resources you need. I've said this before this week, and I'll say it once again. Remember, there is never, ever any shame in asking for help. Every one of us will need help at some point in our life, and that's why our organizations exist. We're here to provide that assistance. So reach out to us. Let us help you in your journey so that we can make it smoother and easier for you, because we want you to be healthy and have a wonderful life as well. We want to thank you all so very much. We hope that you have a wonderful weekend, and thanks for joining us for our 6th annual Pflugerville Conference. Thank you to the Pflugerville Community Church for co-sponsoring this with us again this year. We will be sure that everyone gets information about the upcoming 20th anniversary for the Striking a Balance Conference. It's going to be a tremendous conference this year with amazing presenters from all over the United States talking about caregiving issues and solutions. And then, as Rhonda mentioned, we're going to get together finally in person for a celebratory luncheon. So we'll make sure that we send all that information to you. On behalf of all of our panelists, on behalf of the Pflugerville Community Church in Age of Central Texas, we hope that you have a wonderful rest of your weekend, and we'll see you very soon. Bye-bye.
Bye, thank you.